I'd like to welcome Dr. Catriona Melville to speak to us today. Katrina is a gynaecologist and one of our board members, and when we were going through this project, one of the things we really wanted to do was we realise that when people go into consults, they don't always take in everything that is happening. So this isn't medical advice. This is just something to turn to when you want to go over what happened in your consult, especially if you've had a miscarriage and you're using medical care for afterwards. So thank you, Katrina, for being involved in this.
No problem. Thanks for having me on. It's going to be an interesting discussion.
Yeah, so we just want to give you some background on what will happen if you've had a miscarriage and what sort of medication they're going to give you. So how does it start, Katrina?
Yeah, so if you've had a miscarriage, one of the options you might be given is medical management. And as you said, Peter, that involves taking some medication. So usually if you haven't had any bleeding and it's a complete missed pregnancy loss, so the pregnancy is still in the uterus, they will give you two medications. So the first one is called mifepristone, and that's just a single tablet that you swallow. And it's I guess the best way to describe it is a hormone blocker. So it blocks the hormone progesterone that's going to the uterus, and it also gets your body ready and primed for the second medication. And we know giving the two medications together actually works best. So then what happens is about 1 to 2 days later, you take the second medication, and that's usually done at home, and that's called misoprostol. And that medication's been around for a long, long time. Now, the second medication, you don't swallow it, you actually pop it in between your cheek and your gums on each side of your mouth. And those medications, they don't tend to have a flavour, they're more sort of chalky. They can be quite dry, so definitely have a little drink of water first, or even dip the tablets just very briefly in some water and pop them into your cheeks. And they take about 30 minutes to dissolve. And usually what happens is within anything between 1 hour and a few hours of taking that medication, you will start to have quite strong cramps in your pelvis, a bit like period pains, but they can be quite a lot stronger. And you will have some bleeding. And that's usually when you would pass the rest of the pregnancy or pass the pregnancy itself if the whole pregnancy is there.
And do women get nausea with this?
Yeah, so look, the first medication doesn't usually give you any side effects. Very occasionally, the first medication itself can actually cause you to have bleeding and completely pass the pregnancy. But the second medication can have some side effects. So they tend to be things like nausea, diarrhea, headaches, and you can get a shivery or feverish feeling with that as well. In clinical practice, we usually give women some supportive medication to get them through that second medication. So I would really recommend that people are given some anti-nausea medication, so anti-sickness medications, and that's often something like a little tablet that just dissolves on your tongue. I would also recommend that they have some good pain relief options as well. And often it's a group of medications we call the non-steroidal drugs. So those are things like ibuprofen. They're actually really effective for those strong tummy pains. And you can use practical things as well, like a hot pack as well, and also massaging your tummy between your belly button down to your pubic bone can help. And then also sometimes we give people a backup of some strong pain medication. So that would be something usually with codeine in it, so some Panadine 4 or some Endone. And not everybody wants to take those medications, but I think it's important that you have them there and that you feel confident that you've got all the resources you need to get through the experience.
And there's been some new guidelines come out around miscarriage, and some of the medication options have changed. Can you just talk to those?
Yeah. So the medication options, as I mentioned, if you've got the pregnancy there and you've had a pregnancy loss but you haven't had any bleeding, you would take the two medications. But if you've had a pregnancy loss and you've started to have some bleeding, so with that, we would call that an incomplete pregnancy loss, then often you would just take the second medication. So don't be worried if you only get one lot of medication instead of the two that I've described. Often it would just be the second medication, which are the tablets that you put in your cheek, just pop them in your mouth.
Yeah, so one of the practical things I wanted to talk about is we all use period undies now, and I just think they're fantastic. But when you're going through this, we really recommend that you would use a pad because when you've got your period undies, it's really hard to be able to see how much you're bleeding or how much loss you've had. So with a pad, it's a lot easier to be able to estimate. So that's one of the things that we would recommend that you just changed in your life if you're used to using period undies. Now, we were talking about having sex and using tampons, and I'd really love your opinion on that as well.
Yeah, so it's a very safe way to manage a pregnancy loss using these medication. One of the risks is developing an infection, and there's a very low risk of that. But to make that risk even smaller, we recommend that, I guess the easiest way to remember is nothing in the vagina for at least 7 days. And obviously be guided by your health professional. So some people would say if the bleeding continues and it's heavier, again, don't use tampons or anything until the heavy bleeding's finished. But the rule of thumb would be generally at least 7 days, no tampons. Don't be sitting in water, like don't sit in a bath or swim in those 7 days. Don't have sex either. So that's just reducing the risk of the infection until your uterus gets back to normal and the bleeding's settled down. That's the safest thing to do. And obviously, if you do think you're developing an infection, some of the signs of that might be that you get a foul-smelling discharge, or you start to feel like a bit fluey or fatigued and generally feeling unwell. It's just really important if you feel that in the days after having the medication that you do seek some medical advice, because the feverish feeling you get with the medication, those side effects should pass within a few hours.
And when we're checking for pads, when would you tell women to go and seek medical advice? Like if their pads, if they're changing their pads every 2 hours for more than 2 hours?
Yeah, that's a great question, because we do tell women just to be careful about heavy bleeding, and that's called a hemorrhage in medical terms. And again, that's not a common complication, but it's one of the things to look out for. So generally, we would say that with the sort of thick, heavy pads that you wear, it's okay to soak 2 of them an hour for up to 2 hours. But if you go over those 2 hours, that's when you would say that's too heavy. It's also quite normal to pass blood clots, and they can be, maybe even palm-sized. But if those blood clots kept coming and they were, tennis ball-sized, for example, that would be too heavy. Another practical tip is that, some people, when they've got this pain in their tummy, they don't know, and the tablets can give you some diarrhea. They don't really know what's going to happen or what they're feeling. So often intuitively, women sit on the toilet, because it's where they're most comfortable. And then if you can imagine, if a drop of blood goes into a toilet bowl of water, that looks like a toilet bowl of blood. So that can be quite alarming for women. So what I would say is, if you are sitting on the toilet and bleeding a bit or passing clots and you get worried, is, get yourself cleaned up and settled and pop on that pad like you mentioned earlier. Then you can actually keep a proper eye on what the bleeding's like. The other thing would be, though, if you did feel faint or dizzy or anything like that, that would be another reason that you would want to look for some urgent care.
Yeah, and there's just a few little tips that we were talking about earlier. Try and keep some water and food nearby, even if it's just small amounts of food. If you can take time off work, we know that not everyone has that luxury, but if you can, it is generally heavier than a period from a cramping point of view, and it depends what sort of work you do. And avoid driving.
Yeah, absolutely. And I think, people that have pregnancy losses are in all different stages of their lives. They may have no children and no family commitments, or they may have lots of family commitments. And I often get asked, can I pop the second tablets in and then do the school run, for example? But I definitely wouldn't advise that, because that second medication can work quite quickly. So as soon as you take that, you need to do some self-care, plan a day out from everything else, be at home, have, as you say, Peter, all those practical things around you, just so that you can just make yourself as comfortable as possible. And also, you don't have to have a support person on hand. Not everybody does, but certainly somebody that you can call if there's an emergency or you're feeling really unwell. And obviously, if you do have a support person, they can, rub your lower back and things just to make you more comfortable and just be quite reassuring.
And I know every person is different and everyone has a different medical practitioner, but generally, what's the follow-up care?
Yeah, so it will vary depending on what service you've accessed, but often it will be follow up with your GP, and it might be your GP that's actually started the treatment for you or offered you the treatment. Sometimes it's the early pregnancy assessment service at the hospital, but often your GP is well placed to check up on you, and that may be a couple of weeks later. You can seek help earlier than that, and that's really important if you feel that you are having any symptoms of infection. Or the other thing that can sometimes happen is you don't have any bleeding at all, and that would be a suggestion that the medication's obviously just not worked, and then you would want to get in touch with your whoever prescribed the medication just to let them know and make a plan.
And so if the medication doesn't work or doesn't work fully, what happens next?
Yeah, so the options are that you can take another dose of the second medication, so the ones that goes in your cheeks, and you can take a smaller dose of that, and that sometimes is just enough just to help the uterus to contract down to the normal size and to complete the pregnancy loss. The other option would be a surgical procedure, so that would be an emptying of the uterus surgically, usually under a short general anaesthetic or a sedation.
Okay, I think we've covered pretty much everything. We just wanted to give everyone a second experience so that they can go over what they would have gone over with their doctor, because it is really hard to focus, especially during this period in your life. And that's not for everyone, but we just wanted to make sure that everyone had the ability to come back and listen to what could be happening. And so we'll also do a surgical management as well. Thank you so much, Catriona.
That's no problem at all. Nice to chat.